Covered California is the state's marketplace for the Federal Patient Protection and Affordable Care Act. In partnership with the California Department of Healthcare Services, these two agencies developed a new health insurance marketplace where individuals and small businesses could get access to affordable health insurance plans. In 2014, an estimated 1.4 million consumers enrolled in plans statewide. In May of 2014, the Santa Cruz Sentinel reported that Santa Cruz County enrolled 15,071 individuals. Of that total, 86% were eligible for a subsidy. To lower the cost, and 2,074 bought insurance without a subsidy. We welcome California Assemblymember Luz Alejo, who will share his thoughts regarding our present enrollment numbers.
California can be very proud that we set the example for the rest of the nation. While other states were resisting implementing the ACA or turning away money, California led with legislation because we want to be the example that we can make this work as other states have done. Massachusetts was the first. I think 98% of people in Massachusetts are now covered, have health insurance. California was trying to be the next model that under the ACA we could implement legislation. You had the governor on board, the legislators on board to make this work, and I think so far it's showing some good results. As with any major piece of legislation, there's always some fine-tuning that needs to happen, but I think California in the end we will prove that the ACA was a good thing for the hardworking people of our state.
While we must celebrate our successes, we cannot overlook the estimated 2.6 million undocumented persons living in California who are ineligible to enroll in the ACA. They're the restaurant, landscape, factory, hotel, farm, construction, and service sector staff that we rely on every day for our needs and wants. These individuals are your neighbors, employees, co-workers, fellow churchgoers, not to mention your friends and friends of your children. Let's zero in on agriculture. In 2012, California's 80,500 farms and ranches received $42.6 billion for their output. Exports totaled $18.8 billion in value. California is an agricultural economic powerhouse, growing more than 400 commodities. The state produces nearly half of U.S.-grown fruits, nuts, and vegetables. The food we produce not only feeds California, but the nation. The farm workers who plant, water, weed, feed, harvest, and pack this agricultural bounty are undocumented and largely uninsured or underinsured. Their labor has helped fuel our economy for decades. Because of this legacy and because of their ongoing contributions to our economy, we assert that the undocumented population must have access to quality health care. It is simply un-American to deny one of the most at-risk and vulnerable populations access to health care solely based upon legal status. Health care is a human right. It should not be a privilege. Let me bring it home to Watsonville, California, a Central Coast city wedged in between the cities of Santa Cruz and Monterey. Watsonville boasts a population of 50,000 plus inhabitants, is over 85% Latino, and is largely a farm worker community who rely heavily upon the mishmash of underfunded community clinics and emergency rooms to deal with advanced health problems that may have been avoided with access to preventable health care and primary health care physicians. Ahora, Gerardo Velázquez, un defensor de la comunidad trabajando para la agencia La Manzana desde Watsonville, California, nos comparte sus pensamientos sobre la acta llamada Affordable Care Act.
Hay dos tipos de poblaciones que no califican para este servicio médico, que son las personas indocumentadas y las personas que están encarceladas. La pregunta que todos nos hacemos como advocates o asistentes de este servicio médico de Cover California es: ¿cuándo se les va a dar un seguro médico a las personas indocumentadas? Ellos trabajan, ellos pagan sus impuestos, viven como todos nosotros, pero desgraciadamente no tienen un seguro de salud. Parte de la reforma de salud era evitar los grandes costos cuando las personas iban solamente al cuarto de emergencia en lugar de ver a su doctor. Desgraciadamente, si no les damos seguro de salud a este tipo de personas que no tienen documentos, van a terminar en el cuarto de emergencia. Entonces, quizás sea para el otro gobierno que venga más adelante, o una vez que ya hayamos pasado los primeros pasos de Cover California, algunos años, que haya una reforma de salud para que cubra a este tipo de trabajadores que después de todo son como todos nosotros trabajando para el bienestar de California y de Estados Unidos.
In the absence of any healthcare reform answers, we are joined once again by Assemblymember Alejo, who will provide a solution to this never-ending problem.
So there is a significant number of people who work in our communities, live in our communities, that are not eligible, have no health insurance coverage. They might be eligible for very minimal medical coverage maybe at some of the local clinics at the county level, but there's so many more that do not. So that's been some of the ongoing struggles and efforts that we're doing in Sacramento, and certainly should be pushed in Washington, D.C. The most obvious, of course, is that if Washington can get their act together and pass immigration reform, they would have a large number of undocumented that would now be eligible for health insurance coverage under the ACA.
Immigrant rights are civil rights. Justicia y dignidad para todos los inmigrantes. Todo para todos y nada para nosotros. Immigration reform now.